Okay. So apart from Tinea capitis, Tinea corporis, we have what we call Tinea cruris. Tinea cruris. This cruris is also known as what we call jock itch. It's also what we call jock itch. When you talk of somebody talking of a jock itch, is what we refer to as Tinea cruris infection. This is a dermatophyte infection that involves the crural fold. You know the crural fold. This is fungal infection in the skin of the genitalias, around the genitalia. That is when you have that kind of infection, that is inner thighs and buttocks, and then that is we refer to as Tinea cruris. Okay, and you could see now the difference. Tinea capitis is tinea of the scalp. No, Tinea corporis is tinea of other parts of the body other than what we've mentioned. Tinea cruris is fungal skin infection of the genitalia, and within the thighs and buttocks and all that. So most occurs to people who wear tight-fitting clothing that traps in moisture. I have always been telling, especially ladies, um, as a medical advice, and even some men, because most of the time nowadays men left those tight panties they were using. Nowadays they use boxers which are more free, giving space of aeration. But most ladies still at the moment use a lot of tight panties, which could be a good swag, but it is also dangerous. The worst of all, when you find even at night when they're sleeping, they're still wearing those tight panties. It's medically and not good. You are encouraging a lot of fungal infection. At night, if you are living at a secure place and you've locked your door, remove those panties, put them there, wear free dresses. Have enough aeration, and also by that you'll be avoiding this kind of infection. What are the common drugs, in fungal that cause this kind of this tinea cruris? We have what we call tinea rubrum, uh, Epidermophyton, flocosum. We have Trichophyton digitale, formerly Metagrophyte. So these are common fungal species which affect other parts of the body like the scalp, but they be can easily spread through body contact or even fomite to those areas we've talked about. So this cruise is far more common in men than women, interestingly. Why? Because often infection results from the spread of the dermatophyte infection from concomitant tinea pedis. You will see what tinea pedis infection is. So the predisposing factors include copious sweating, obesity, diabetes, and immunodeficiency. So those are the predisposing factors. A lot of sweating happens the way I said in men, and most of the men fear water. So because of that, and most of the men they wear also closed shoes. So that closed shoes, the tinea of the skin of the feet. When you are now doing the cleaning of after washing yourself, unapitisha mikono kwa vidole, then you are spreading all over your body through thighs and all that. As you do that, you'll be spreading that tinea infection from the feet, bringing it to the groin. And that's where we are saying men are more common with this. So, but for women, I have also just given a demonstration on how possibly you can have a persistent infection and how to treat it. Presentation. This cruise begins with an what we call erytheromatous patch on the proximal medial thigh. The infection spreads centrifugally with the partial central clearing and slightly elevated erythromatous. In males, the scrotum is typically spared. How? That one you can do the research, but this sharp demarcation